We are joined today by Jessica Cruz, who is the CEO of NAMI California, and by Francesca Schuler, who is the CEO of InShape Health Clubs. Thanks to both of you for your time.
Thanks for having us.
Let me start. We all know that we're going through this prolonged shutdown. We're now going through different stages of reopening, but the bottom line here is that for a long period of time, we've got people, adults who, if they're still working, are having to learn about remote working, and of course, students who have to deal with distance learning. And as a result of all this, we're seeing what some was a predictable impact on behavioral health. So Jessica, let me start with you. What impact are you seeing on behavioral health? What is NAMI seeing?
Well, you know, since just the shutdown in general, we've seen a heightened state of anxiety, depression, substance use. It's actually been documented and well researched by CDC, and Kaiser Health just did a survey, and both found in June and July that an increase of 40 and up to 44% of adults responding since the pandemic have reported some sort of anxiety, depression, substance use, stress. And there's so many different factors, right? It's not only the stress of having a pandemic and being in a pandemic and wondering whether or not we're going to get the virus, but it's the economic downturn. It's for some parents and kids. We're seeing a high rate of kids having anxiety and depression. We're also seeing, from NAMI's perspective, we have 62 affiliates throughout the state of California that provide services and supports for families and individuals. We've seen a significant increase in calls to our warm line for people trying to just figure out, where do I go, who do I call, what do I do to try and seek services. So when we talk about the mental health impacts of the pandemic, they're real, and they're now manifesting in, and as we have seen, into some physical impacts. And we know that the brain and the body are connected. And so when we are starting to feel sluggish, or we're eating a little bit more, we're not sleeping well, those can sometimes be some early signs and symptoms of some anxiety and depression.
Francesca, how does that account square with what you're hearing and seeing from members of the clubs?
We're seeing the exact same trend. I couldn't agree with Jessica more on the linkage between mind and body. I don't know, in the end, I think it's going to be a chicken and an egg discussion depending on the person. There are people who count on physical activity to help them relieve stress, to sleep better, to relieve anxiety, and honestly just to feel better about themselves. And that has been denied in California to the majority of Californians for the last 6 months, because not only have fitness centers been closed, but it's been really hot and really smoky. And so we're hearing repeatedly from our members, while we've been closed, we now have a few clubs open, and the gratitude with which people are coming back to be able to move physically again is really as much about their mental state as their physical state. So we've also seen there's going to be a study being released shortly on health of Californians, people who were health club members. And we were seeing similar statistics. 60% of them stated they were feeling a higher level of stress. Over 50% felt their mental health was worse. And these were people that were healthy before the pandemic, working out, etc. So these are not people who were struggling pre-COVID. These are people who were actively engaged in their health, and they've gone backwards. So really similar trends, which I think is one of the really sad byproducts of this pandemic that will be around for a while.
So clear evidence that access to fitness equipment, fitness facilities does make a big difference in outlook and mental health, behavioral health. Is it a physiological thing, release of hormones, or is it just the need for social interaction? How would you both describe it?
Go ahead, you start.
Well, we know that exercise has a component of that can bring some sort of happiness to the brain, right? I am no expert. I am no doctor. I'm no clinician. But we do know from experience that exercise as a piece of somebody's treatment plan, as a part of somebody's self-care, can help move them in a direction that is more positive, right? We rarely hear an instance where exercise does damage to a person's mental well-being. But there's far more positives that come out of exercise and the social connections, whether you are in the gym or you have a workout partner. There are a lot of different factors that can help attribute to the positive behavioral health and really self-care. It's wellness in a lot of ways, although there are several studies out there by the National Institute of Health that say that exercise for people who are even diagnosed with such severe behavioral health issues like schizophrenia have helped in their treatment process. So it is more, and I think that it is that hidden piece of somebody's treatment plan that gets overlooked, right? Like usually people who are diagnosed with some sort of behavioral health condition, it's go to treatment, visit your doctor, and take this medication. But we forget about the family involvement, the social aspects, the exercise, you know, the ability to move your blood and get those dopamine, you know, receptors activated to help in the process that then the medication, the treatment with your doctor can then be enhanced almost.
Francesca?
Yeah, I completely agree. I'm also not a doctor, but there's no question there have been a myriad of studies of the literal physiological effects of exercise on the brain, all of which are positive. A bigger piece that I think people underestimate too, which goes to the social as well as your own sense of confidence, is at InShape, we talk a lot about fitness giving you confidence. We don't talk about fitness in terms of losing weight or getting stronger. A lot of it's you feel better about yourself. And one of the interesting things we've seen during this time of pandemic is when people are able to exercise, it gives them a little bit of a sense of control. They're like, okay, I can manage this part of my health. Okay.
And control is really important right now, right?
It's really important. It's like, how can I feel like I have some say in my health? And in a time when there's a somewhat unknown virus, you know, we've learned a lot. We know masks work, physical distancing. But what we also know is a healthy immune system is critical. And what we see for members, we've opened several clubs with outdoor facilities. So as we've gotten members back exercising, really it's that confidence, a little bit feeling of can have an impact and manage how I feel and hopefully how my immune system responds. That is as much a factor as the actual literal science of, you know, releasing endorphins in your brain. And the social part of that's huge. I think people think, oh, it's so hard to wear a mask. It's, you know, we have to be physically distanced. To be honest with you, I will take a virtual high five 6 feet apart from somebody else in person all day long versus a high five on Zoom. There is nothing like looking people in the eye and watching them sweat. I'm sweating. We're totally physically distanced. It's super safe. We're wearing masks, but there's a feeling of inherent community that we are trying to be healthier together. And I think that really impacts our mental state.
Well, as we know, there is no quick fix for behavioral health issues. And Jessica, you've dealt with this for years, and especially with the whole issue of stigma. Do you get the sense that the pandemic and the shutdown and the lack of access to social activities such as exercise, is that to some degree reducing the stigma, making people more willing to talk about these issues?
I hope so, right? A lot of the work that we've been doing, and I've been in this position for a decade, has been around reducing stigma so that people can have the ability to talk about how they're feeling and making sure that they're taking the necessary steps to get the services that they need. I think that, you know, stigma is it's the biggest barrier to people receiving services. And there is this just stigma around, I am weak because I am not sleeping well, I feel sad, you know, I'm hearing voices, I'm paranoid, whatever the case may be. My family members are like this, I don't know where to go. There's so many factors to what contributes to the stigma. But the piece that I think that is important to the conversation today is that because exercise provides an opportunity for that feeling of self, that feeling of I've accomplished something, that feeling of, I know for me, and I live with a mental health condition, and for me, exercise, if I don't get it, it really impacts kind of the trajectory of my day in some ways, right? And I can tell by the sleep that I get that night, by how I respond and react to my children and my husband, that there's something off. And if I don't get it continuously throughout the week, then I can see more of my severe symptoms kind of come out and attribute to potentially a little minor breakdown for me. But to be honest, I think that the stigma for people is to be able to talk about it, to talk about what affects them and the steps at which they're taking to help themselves, right? And again, exercise opens the door for people to say, yeah, you know what, it helps me too. And, or, you know, I haven't tried it. And it looks different for everybody, right? Like my mom, her exercise is going outside and gardening, to be honest, you know, where mine is like getting on a spin bike or running 3 miles, or like I need that hardcore cardio or weightlifting, right? But it doesn't have to look a specific way. And I think that sometimes stigma will get in the way of that. I have to take this medicine and go to the doctor, but it doesn't have to be that. It can have a lot of contributing factors around your own wellness. And I think it's so imperative for all of us to talk about how our mental health impacts our physical health. And there are direct signs. People living with a mental health condition die 25 years earlier than others. 25 years earlier. And that's because their body is shutting down. It's because of the medications that have the adverse effects to them, right? There's ways we can combat that by exercise and eating right and taking care of our bodies. So hopefully that number will start to go down as also the stigma number starts to go down.
So Francesca, you've been hearing Jessica talk about the impact on her, and clearly there's all this evidence that for people who are suffering through some kind of behavioral health condition, whether it's depression or just having a hard time getting started, that access to fitness and to fitness facilities really can put people kind of on that starting point to a recovery path. But how would you describe it?
Yeah, I completely agree. I think one of the things that we are seeing in a very positive light as people are coming back, as fitness centers are slowly reopening, the gratitude is incredible and the dialogue is changing. So just, Jessica, I'm super hopeful with what you're saying that the stigma will start getting more and more, because I think all of us, look, myself included, completely underestimated how important that daily sweat or however often you do was to really your overall well-being. And so I think we're seeing that when something gets taken away, I think it causes you to really reflect on why you need it, how important a role it plays. And while it's easy to be quite dismissive and say, go outside or buy a Peloton or do a home gym, motivation is the most challenging part of a good exercise routine for anybody. I would say our biggest competitor is a snooze alarm. And so being able to provide an environment where people feel some motivation to come, and that is due to access to a variety of equipment or seeing their community, or to be able to share how hard it's been. I mean, everyone comes in and has a story right now about they've lost someone, they've struggled, and it's no longer about my body fat's gone from here to here. It is like, I am so grateful to be back here and please don't ever close again. And so I think the hope that I have around the mental physical health linkage is that physical health becomes as important as brushing your teeth every day. Because if you exercise every day, that'll impact your mental health and your physical health. And I think it's something people shouldn't take for granted, and we need to make sure everyone has access to it. The only other thing I'd add on that is being at home all the time is hard, and it's hard for many who have challenging situations at home, who may not have a lot of room at home, quite frankly. Many people's homes are not designed to have everyone at home 24/7. They sort of assume you go somewhere during the day. It's also maybe a place that they aren't as happy, and so giving people a third place to go where they can be themselves, invest in themselves, do some self-care, like going to a health club, is really critical for many people. And I think that's been lost a little bit in this whole sort of shelter in place. Oh, no problem, stay home, sit on Zoom all day. think the ramifications of that are huge.
And Francesca, you touched on this, but I wanted to ask you specifically about the link between exercise and fitness and overall systemic health. We've been talking a lot here today, obviously, about behavioral health. What's the link between the access to fitness and to equipment and overall systemic health?
Yeah. So I think health is mental and physical. One of the most fundamental parts of our body that we need all the time is our immune system. And I don't think everyone realizes that exercise is critical to keeping a healthy immune system. And when you look at the tragedy of all the people that have died from COVID, the majority of them have suffered from an underlying health condition, most of which are chronic conditions that can be, really avoided with sleep, great diet, and exercise. So exercise it's one of the three-legged stool, I say. If you can eat well, if you can exercise, and you can get some sleep, you can face a lot and keep going. And so the concern we have, and we've seen it a lot, is that many of our members are struggling with missing one of those key pillars, obviously not being able to exercise, and then being isolated from their community, which I'm sure Jessica, to all her point about the phone calls increasing to all these helplines, a huge part of that's isolation. And so just underlying basic healthcare, everyone should have access to a way to exercise, to eat right, and to sleep well. And right now that's been denied here in California for 6 months. And the ramifications of that, I think, are going to be long. The good news is if you get at it, you can rebound. So it's not the positive of this is we always say every day is a restart at Its Shape. We don't penalize you if you decide to restart on Monday and you got to do it again on Tuesday. That's okay. So there is hope that you can keep moving forward. But you need to have access to a place that's safe, air conditioned, has all the right safety protocols, so you can follow your fitness routine, whatever it may be.
So for people who are experiencing higher level of symptoms, really asking them to go and seek their care from their provider, because even though we know that exercise and certain components of self-care can really have positive impacts, it's really important for all of us to internally take a look at how we're feeling, how severe that is, and then making sure that as we're having this conversation, wonderful conversation that I truly believe in, sometimes, again, we need to seek a higher level of some sort of care. And again, exercise will always be a component to a treatment plan where you talk to doctors about what's happening. And so definitely it is something that is a positive impact, but that if anybody is in need and is thinking to themselves that I need something more than exercise, please seek your physician in doing so.
Could not agree more with that. So
I was going to ask if you had a final thought, Francesca.
Look, I think if you 6 months pre-COVID had thought that me, who runs a healthcare chain, and Jessica, who's focused on the mental health of our state and our people, would be on a phone call together talking about what can we do to ensure the long-term health of our communities, I'm not sure either she or I probably would have said, oh yeah, that's my top 2 discussion of the week. Right. And I think what it's really highlighted is the need for collaboration between prevention. So that includes your doctor, exercise, diet, sleep, etc., and treatment. To Jessica's point, could not agree more. Treatment is really important, but we need to have a collaboration and kind of an ecosystem where we help each other. And so love that we're starting this dialogue. And I think it will take away the stigma. It's going to be increasingly okay to talk about not feeling great, whatever that is. And it's upon us who participate in this healthcare ecosystem to collaborate together to help our members and our communities get access to what they need and stay healthy. So I really appreciate being part of this. Like I said, 6 months ago, I'm not sure you and I would have prioritized it. Yeah. And I love that that is one of the bright spots that will emerge from this, that I think we will provide better integrated solutions for people, whatever their needs may be.
I love that. Couldn't agree more. That's wonderful.
Francesca Schuler and Jessica Cruz, thanks so much for an important discussion.